Hello, this is Eugene Gabbianelli at Georgia Eye Partners, and I would like to talk to you about modern cataract surgery. So, what is a cataract? A cataract is a clouding of the lens inside the eye. The light hits the cornea at the very front of the eye and then passes through the pupil and hits the anatomic lens within an eye. With age and with some medical conditions, this lens can become cloudy and impair your vision. Cataract surgery, one of the most commonly performed procedures here in the United States, essentially allows us to remove the cloudy lens and replace it with a clear plastic lens. The procedure takes approximately 10 minutes, and the patient will typically use eye drops for 3 or 4 weeks following this procedure. Let's talk a little bit about the risks and benefits of cataract surgery. This is an extremely safe procedure, and we perform thousands of these each year in the United States. The end result after the surgery is more clear vision, and the serious complications that can happen with cataract surgery include the possibility of either a hemorrhage in the choroidal blood vessels behind the retina, or an infection that can develop 2 to 5 days after the surgery. These are both extremely rare complications happening in approximately 1 out of 5,000 cases. And we can discuss this further with you in our office. Now, let's talk about what a patient can expect after cataract surgery. Cataract surgery allows us to do 2 things. Number 1, to clear off the disease process, so remove the cloudy lens. And then number 2, to make the patient less dependent on glasses and contacts. Let's talk for a moment about number 2, the less dependence on glasses and contacts following cataract surgery. There are several choices for you to consider. The first is both eyes with beautiful distance vision. However, you require reading glasses for up close, and that's the standard approach. The second choice would be both eyes for up close vision and the use of distance glasses. A third approach would be called monovision, which is 1 eye for distance and 1 eye for up close. And then there are a variety of higher technology intraocular lenses. One is called a toric, T-O-R-I-C, intraocular lens, which can correct astigmatism. But that also is a single vision lens, so we would target either distance or near in that particular eye. And then there are multifocal and accommodating lenses. Multifocal lenses allow distance and up-close vision. They allow both, as does an accommodating lens, which has a shifting of position inside the eye. The multifocal lenses achieve their distance and near capabilities due to a number of diffractive rings which are etched into the acrylic plastic of the intraocular lens. So, let's talk for a moment about these higher technology options, the multifocal lenses. The distance and near capability of this lens is excellent. However, when a patient utilizes a multifocal lens, they're going to get a small amount of glare and halo with their distance vision. And the way this works out is that 49 out of 50 patients are happy that they chose this lens. They have distance and near, and they say, yes, I have a little bit of glare and halo with my distance vision, but I'm certainly happy that I chose this lens. The 1 patient out of 50 never achieves neuroadaptation where their brain works comfortably with the newer optics in this lens. So for 1 patient out of 50 with the multifocal lens choice, we do need to go back and exchange the lens. And this is a relatively simple procedure which typically would happen approximately 3 months after the original procedure, and we would essentially replace the multifocal lens with a monofocal lens at that time. This discussion is meant to be an introduction for you about your lens options with the cataract surgery, and also to educate you about the cataract surgery process. And just to review, when a patient's having cataract surgery, the choices would be distance vision, or near vision, or 1 eye of each, or the multifocal lens to see distance and near, or an accommodating lens which would allow you to see distance or up close. One other topic to discuss is that at the end of cataract surgery, it is possible for a patient to have a small glasses prescription different than their intended target. And if that is the case, we can certainly go back and do a fine-tuning laser vision correction procedure which would slightly change the shape of the cornea. And it's important for you as the cataract patient to understand that this is a possibility, the fine-tuning laser procedure, to achieve exactly the intended outcome in terms of glasses independence. One final topic is that a patient who has had previous corneal surgery, including radial keratotomy, or PRK, or LASIK, or corneal transplantation, is a slightly more difficult patient to achieve the exact intended refractive outcome. So if you have had LASIK or PRK or RK or transplant prior to your cataract surgery, there is a higher likelihood that you might need the further laser fine-tuning a few months after your original procedure. We look forward to speaking to you more in depth about cataract surgery here in our practice at Georgia Eye Partners, and we will discuss with you in depth here in the clinic all of the lens options as they relate to your particular situation.